All right, all right. I'm Dr. Christine Obway. I'm the Assistant Commissioner for the Bureau of Ryan White and Community Risk Reduction Services at the Baltimore City Health Department. And I have the distinct pleasure of introducing Dr. Michelle Taylor, the Health Department's new Acting Commissioner of Health. Prior to her role as our acting commissioner of health, Dr. Taylor served as the Shelby County Division Director of Health Services in Memphis, Tennessee. Additionally, she serves as colonel and residency trained flight surgeon in the Tennessee Air National Guard. Dr. Taylor holds a bachelor's degree from Howard University, master's degrees from the University of Tennessee and Harvard, a medical degree from East Tennessee State University, and a doctorate of public health from the Johns Hopkins Bloomberg School of Public Health. As a proud Memphis native, Dr. Taylor brings a wealth of leadership experience and passion for optimizing the health of all Baltimoreans. Over the past few weeks, her warmth and enthusiasm have been infectious. We truly look forward to what we will accomplish with her at the helm of the health department. Now I will turn it over to Dr. Taylor for some remarks.
Good afternoon, everyone. I'll try again. Good afternoon, everyone. That sounds great. Everybody looks so good. Give yourselves a hand. I'm Dr. Michelle Taylor, and this microphone is not going to cooperate, so I'm going to take it off of this. I'm honored to join you to commemorate Baltimore City's 11th annual International Overdose Awareness Day. Yes. I would like to thank the Office of Overdose Policy and Strategy and the Community Risk Reduction Services teams at the Baltimore City Health Department for their hard work in bringing this event together and for the dedicated service they provide every single day. Yes, give it up for them. Overdose Awareness Day is intended to send a message of support and hope to families and friends of those who have lost loved ones to addiction, individuals who are in recovery, and individuals who are living with a substance use disorder and have experienced non-fatal overdose. This day aims to shed light on overdose deaths and remember the lives lost this year and in previous years. Within just 4 weeks as acting health commissioner, I have seen both the impact the overdose crisis has had on Baltimore City and how tenacious and creative Baltimoreans are in the face of adversity. That's right. Looking out at those gathered here today, I see so many people who I already know have dedicated their lives to supporting people who use drugs, even in the face of stigma. Thank you to those who keep working even when you are tired. Now, let us take a moment to honor those we have lost to overdose. 1,043 lives were lost to overdose in Baltimore City in 2023. Preliminary data shows that over 777 people died from an overdose in Baltimore City in 2024. So far, in 2025, we are on track to see a continued decrease in overdose deaths, but Baltimore remains an epicenter for overdoses nationally. To those of you who have lost friends and loved ones, we stand in solidarity with you. Each life lost, each life lost represents a loved one, a parent, a child, a sibling, or a friend whose absence is deeply felt. We know this, but it bears repeating. Substance use disorder is not a moral failing. Substance use disorder is not a moral failing. It is a chronic disease and a public health issue. We hope that through the activities and connections made and strengthened today, we will be reminded that we can all play a part in preventing overdose deaths. At the Baltimore City Health Department, we continue to do all we can to face the critical challenges within the overdose crisis. Last year marked 30 years of our syringe services program. Give it up. Yes. This September marks the 1 year anniversary of the launch of our first harm reduction vending machine, which has given out over 4,000 harm reduction kits to help save lives. Yes. Now we are building a new division of public behavioral health to further programming to help prevent overdoses. I'm honored to be leading the agency at this critical time. I know I am preaching to the choir here, but here are a few things we can all do to prevent overdose deaths. You all ready? 1. Support increasing access to on demand and evidence based treatment. Yes. 2. Dispel stigma and spread the word about 988. Yes, call 988 if someone needs services for substance use and mental health. 3. Support the incorporation of behavioral health care into traditional healthcare systems to reduce stigma and increase access to services. We must do this. 4. And of course, 4. Get trained and carry naloxone. Everyone in Baltimore City should be committed to the fight against the overdose crisis. We're in this together, you all. To building a Baltimore where we reject stigma and ensure that everyone can thrive. I want to thank our wonderful mayor, Mayor Brandon Scott, for helping and leading the fight against the opioid crisis, and our partners, providers, and advocates, to include our council members, for the tireless work you do every day to meet people where they are and to offer hope, dignity, and healing. Thank you so very much. I will now turn the mic over to our wonderful mayor, Mayor Brandon Scott.
Thank you, Dr. Taylor. Make some noise for our wonderful new fabulous health commissioner. And I want to start there by giving a shout out to the health department for bringing us all together again and for putting on today's resource fair and for the work that they do each and every day. We know that so much around harm reduction as far as city governments around this country started with the Baltimore City Health Department, the OG. Let's make some noise for them. And thank you for that warm introduction, Dr. Taylor. And thank you all for being here as we mark International Overdose Awareness Day in Baltimore again. And we know today is a day of many emotions. And I'm so proud today to be joined by so many of our partners in government. We have my state senator, my brother, Senator Corey McCray, has joined us this afternoon. Our City Council President, Zeke Cohen, has joined us this afternoon. The Chairwoman, Councilwoman Felicia Porter, has joined us this afternoon. And they all know, we all know that today is a day of many and mixed emotions. First and foremost, it's a day of grieving, a day to remember the hundreds of parents, siblings, friends, and neighbors we've lost to overdose this past year, and the thousands that we've lost in the arc of this crisis. And for everyone who has lost someone to overdose crisis, our hearts are with you today and always. And as I always say, I don't know anyone that has been in Baltimore more than 5 years that doesn't know someone that has been impacted directly by this crisis. And as we remember those that we've lost together, we can also make this a day full of hope. Hope that we can and will be finally putting an end to the overdose crisis here in Baltimore. Tomorrow marks 1 year since I signed an executive order for us to reduce fatal overdoses in Baltimore by 40% by 2040. Uh, yes, we will do it. This summer, we released a needs assessment and a strategic plan to help us get there. And our law department has taken on Big Pharma in court, as you know, and have secured $552.5 million in funding that we're going to be investing back into our communities. Today, I am excited to be making two announcements that will help us keep that momentum going. First, let me be the first to tell you that the city of Baltimore is now officially a silver level recovery friendly workplace. And under this designation, we know that we're removing barriers to employment for folks impacted by substance use. We know that recovery from substance use disorder shows strength, perseverance, and a dedication like no other. And that's exactly the kind of values that we're looking for in our employees. And another key part of this designation is making sure that all of our employees have access to naloxone and are trained in how to use it if they see someone experiencing an overdose. And our goal is to have at least half of the city's workforce trained in the coming weeks. Second, in the coming weeks, the city will be rolling out a new campaign called Naloxone Neighbors. We know that nearly 2/3 of fatal overdoses in Baltimore take places inside people's homes, Mr. Senator. Not in an alley, not in a park, not in a car, in someone's own home. Which is not a common thing that you hear out in the atmosphere. But, as I often say, women lie, men lie, numbers do not. Which is why we're partnering with neighborhood and community associations to make sure as many of our neighbors as possible have naloxone in their homes and know how to use it. No one has to die in their home simply because their family and friends, those who they live with, do not have the materials or the training to save them. And they'll host naloxone training sessions at community events. That will be done by our naloxone neighbor captains, and we are leaders of those associations across the city are stepping up to do that. They will be leading those training sessions at events like block parties and stoop nights and their community meetings, and they will lead, which I think is the most important part, door-to-door knocking day to distribute naloxone and train neighbors on how to use it, telling them the reality of how people die from overdose in Baltimore. I want to thank them for getting involved and encourage the rest of you to follow suit and tell Lottie, Dottie, and everybody that we can save lives together. We can remove stigma together. We can end overdoses in Baltimore the only way that we're going to do it, and that's together. Because there is no one simple solution to the overdose crisis, but together we can make real progress because every single overdose is preventable. And we have to keep people alive in order for them to find success in life. And together we will build a Baltimore where each and every one of us can thrive, even those who are recovering from some substance abuse disorder. Thank you very much. And with that, I'm going to do my official duty today and read this proclamation. Proclamation by myself, Brandon Scott, Mayor of the City of Baltimore, for International Overdose Awareness Day, August 31st, 2025. Whereas International Overdose Awareness Day was created to raise awareness regarding overdose, reduce the stigma of drug-related deaths, and acknowledge the grief impacting families and friends of those lost to overdose. And whereas drug addiction is an affliction that infects not only those in the grip of addiction, but their friends, family, and entire community, the city of Baltimore does affirm and acknowledge the harm and hardship caused by drug overdoses. And whereas the city of Baltimore understands that this devastating epidemic deserves our full attention and is proud to join with the Baltimore City Health Department, our community leaders and stakeholders in a shared commitment to aggressively address this serious life or death issue. And whereas Baltimore City's trauma-informed strategy to address opioid addiction and overdose includes the following: prevention and education, enhanced treatment accessibility by expanding access to high quality, effective, and readily available treatment options, and stigma reduction. And we resolve to work diligently to reduce the toll of overdose in our community, which claims hundreds of lives in Baltimore each year, with countless more affected forever. And whereas today we affirm that the people affected by overdose are members of our family and community, deserving our love, compassion, empathy, and support, we extend a message of encouragement and optimism to the loved ones, individuals grappling with substance use disorder, as well as to those who are currently or have previously experienced substance use challenges. Therefore, I, Brandon M. Scott, Mayor of the City of Baltimore, do hereby proclaim this as International Overdose Awareness Day in Baltimore and encourage Baltimore residents to join in this observance. Thank you very much. You're welcome. And with that, I will turn the microphone over to the man who I got the most advice from about being a father, my good friend, my brother, one of the best public servants I have ever known, someone that I've known now for, oh my goodness, Corey, for almost 20 years, my good friend, Senator Corey McCray.
How's everybody doing? How's everybody doing? First, can I just give a shout out to my mayor? My mayor, when I look at him, not on a local level, not on a state level, but on the big stage, the national stage, he is leading and leading with grace and making sure that Baltimore City is represented. Can we give a round of applause to my mayor? I also think about Madam Health Commissioner. When I think about Madam Health Commissioner, I think about the work. I heard you say it, Mr. Mayor. I heard you say OG, but our commissioner, our health commissioner, leading historically across this country, I just say thank you, thank you, thank you. But more importantly, I look forward to your continued partnership on this journey. You see, y'all, we're joined here. You have the mayor, you have the health commissioner, you have your council president, you have Councilwoman Porter, you have a number of organizations here today, because this is so important. You see, I think the mayor said it clearly. He said that these folks are our neighbors, they're our neighbors, they're our family members, they're our friends, and we have to make sure that we let everyone know that everyone is a part of this, that everyone is a part of recovery, that everyone is a part of recovery. When we think about overdose prevention to me is about dignity, Madam Health Commissioner. You see, when I think of every single person deserves to have access. Every single person deserves to have care. You see, every single person, Madam Councilwoman, deserves to have that support that's necessary for them to be able to live no matter where they reside. You see, this is about helping folks not just in the beginning of the struggle, not just in the middle of the struggle, but making sure that we're there each and every part of that struggle and letting them know that they are not alone. You see, Council President, I look at folks on a federal level, and there are some folks that come with the philosophical view that you have to rush your way out of this. You see, that's not the view of Baltimore City. You see, when we think about this, we have to invest in prevention. We have to expand harm reduction. We have to strengthen pathways to recovery, Kim. You see, and I think about those neighborhoods, Mr. Mayor, because when we think about equity, we know that some of our neighborhoods may bear a disproportionate amount of folks where those resources are necessary and we have to do what we have to do. So I just came here today, y'all, as this International Overdose Awareness Day, and I let you all know that I'm committed. And not just be committed, but we all need to recommit. Recommitting to supporting our families, recommitting to supporting each and every person that's on that road to recovery. And I just say thank you, thank you, thank you for what you're doing today. Thank you again. Do I introduce my council president? All right, y'all, I almost forgot the big job I got to do. So this guy right here, my friend Z Cohen, my council president Z Cohen, I think about the work and I think about how you're leading for not just our city, but more importantly, our council. Can you guys give him the biggest round of applause for his leadership? And I thank you for being with us at this moment.
How's everybody doing out there? All right, good energy. Well, listen, I want to first thank my friends and colleagues on the stage. Councilwoman Felicia Porter, doing a great job leading our health committee. I want to thank my soon-to-be health commissioner, acting at the moment, but brings a ton of energy to the city of Baltimore. Excited to have you on board, Dr. Taylor. Oh, give it up for Dr. Taylor. Gotta show some Baltimore love, come on. I want to thank my mayor for leading from the front, for acknowledging, just like Corey said, that this issue is not about criminality. It's about accepting people, accepting that this is an illness, acknowledging it, and helping folks find recovery. So thank you, Mayor Scott. And a consummate champion for this work all the time, hardest working state senator in the 45th district, Senator Corey McCray. Give him a big round of applause. And I'll just be brief and say, look, this is an issue that impacts your family and my family. And it was not too long ago that I had a cousin who was very, very close to my wife, brilliant woman, lawyer, just amazing leader in her community, who during COVID got on antidepressants, then got on painkillers, then graduated to heroin, then fentanyl, and by the time we found out about it, she had legally died twice in overdoses. To Corey's point, to the mayor's point, she wasn't overdosing out on the street. She was overdosing in her apartment building where no one could find her. Thank God somebody did find her and administer naloxone, or she would not still be here. But I say this to say, it is a struggle that impacts so many families. It is something that is deeply personal to me and to all of us. And this idea that we would criminalize this disease was so very wrong. And I am so proud to live in Baltimore in this moment where we recognize that addiction is not evil, it is an illness, and we are a community that together can overcome it. So I'll just close by saying one of my most proud moments as city councilman in the 1st District, we passed a law. We made Baltimore the first city in America to legislate trauma-informed care. One of the things we did, Dr. Taylor, with our library system is the head librarian at the time said, we need to stop criminalizing folks who use drugs. We need to be a support to them. I want to get rid of zero tolerance, and I want to bring peer navigators into the libraries. And I'm really proud to say that Baltimore is one of the first and one of the only cities in America to have peer navigators in the Enoch Pratt Free Library System. It's a big deal, and I thank all the peers and Tiffany Scott, who I see out there doing the work. Last thing I get to do is introduce my colleague. She's brought a fire and a ferocity to this issue. She has been a champion for public health and for making sure we keep the opioid crisis as a public health issue front and center. I'm grateful for her work and leadership. Give a big round to Councilmember Felicia Porter.
Hello, Baltimore. Hello. So, on this International Overdose Day, we know that every single day we lose someone, a neighbor, a friend, a parent, a child. And the truth is, behind every number, there is a name, there is a story, and a heartbeat that once held hope. Since 2003, more than 2,000 people have died of an overdose in Baltimore City. In Baltimore, just let that sink in. 2,000 lives have been gone. And as of this week, there are 298 people that have died in 2025 alone. These are not strangers. These are our sons. These are our daughters. These are our brothers and our sisters. And as the senator mentioned, these are our friends and our neighbors. Every single day, residents call my office and they share the names of people that they see that are actively using. They call because they are crying for help, not only for the neighborhoods, but also for those individuals that are struggling. We know that people are the key, and they are worthy of recovery. They are worthy of second chances. They are worthy of compassion and not condemnation. And this crisis is not hitting everyone the same. We know that. Overdose deaths occur in so many of our neighborhoods. Black men over 55 years of age are seeing this at an exponential level. We are seeing mothers experiencing overdose. It is impacting our young people on a drastic level. And as we celebrate today on International Overdose Day, I want to make sure that everybody understands that this is not just an issue of public safety. It's not just an issue of public health. This is an issue of health care. This is an issue that health care brings to the table for a community. And no longer can we step aside and just allow the criminalization of so many of our family members, so many of our neighbors within the city of Baltimore, because I guarantee you, you look left and you look right, there's a person that has been impacted by the opioid crisis, and there's a person that is still in recovery. So as we recommit ourselves today, let us not just do these things just for ceremonial purposes. It comes with real advocacy, real policy that not only takes into account the individuals, but it also takes into account the quality of life of the community, the quality of life of the clinics that they're going to, and also the quality of life of our city. Thank you all so much for coming here today. I cannot implore you enough. We as leaders standing here on this stage, we are not just saying that this is one day. This is a moment in Baltimore where we are taking the catalyst and we are taking it forward and being the leaders in the nation, being the leaders in the state of Maryland, and finally being the leaders in the city of Baltimore. Thank you all.
Hello, everyone. My name is Sherika Green. I'm the new director of Overdose Policy and Strategy at the Baltimore City Health Department. And I'm so thankful to have all of these wonderful people come up and share this day with us, as well as all of the partners and vendors. So thank you, Councilwoman Porter. Thank you, Dr. Michelle Taylor. Thank you, Mayor Brandon Scott. Thank you, Senator Corey McCray. And thank you, Zeke Cohen. We're now going to have the Helping Up Mission Choir perform for you guys and continue the program. So thank you. Continue to enjoy and visit the resource tables. Continue to enjoy and visit the resource tables. And I would like to ask the Helping Up Mission Choir to